So continuation, Bismillah Rahman Rahim, continuation of our oral care products chapter. So in continuation to our second lecture in continuation of this. So now today we learn about oral care products. Earlier we have learned about what's the hygiene, how to clean your teeth. Now today we learn about the products, toothpaste, mouthwash, and sometimes when people need teeth whitening also. Because to make a good face value, they have a clean teeth and whitening teeth. Actually, the enamel is not pure white, but what we have to do, make it pure white. So first we do what's the toothpaste are. So paste or gel cleaner used to clean and improve the aesthetic or pleasing appearance and health of a teeth. So your face value improves when your teeth are clean and shining. So what they do, paste or gel cleaners used to clean and improve the aesthetic or pleasing appearance and health of the teeth. This is the main function of the toothpaste when we are going to apply. Now further if you go through the history from where they have started the toothpaste, the earliest known reference to a toothpaste is in a manuscript from Egypt in the 4th century before Christ, which prescribes a mixture of powdered salt, pepper, mint leaves, and iris flowers. So it was in before 4th century BC when they have a mixture of powdered salt, they have a salt, then they have pepper, the mint leaves, and iris flower. हेलो वासलाम अब बाद में रिंग कर सकते हैं मैं भी क्लास ले रहा हूँ 1 बजे के बाद So flowers, this was the first toothpaste they have prepared powder. So but then it is in the early 1800s, the toothbrush was usually used only with water. First, they were using the applied toothbrush, just put water, and then they used the toothbrush in 1800s. Then soon tooth powders gained popularity in Britain. Most were homemade with chalk, pulverized brick, and salt being common ingredients. Toothpaste was first introduced by 1900 and replaced with the tooth powder. So earlier they were using tooth powders. Now they are using now the toothpaste in 1900 century. Then good toothpaste parameter. What the parameters for a toothpaste may be? First, easy to extrude from package. It must come out easily from the tube, whatever it is. Second, does not run off the toothbrush. The third, holds its shape to a large extent after extrusion. It must be uniform, not overly stringy, disperses readily while the teeth are being brushed as shiny surface, pH formulation between 4 to 9. Now formulation of toothpaste is general toothpaste formulation composition contain what they are one agents they contain abrasives, detergents, water, humectants, thickening agents, flavor, and sweeteners. Further, they have preservatives, corrosion inhibitors, colorants, bleach, anti-caries actives, anti-calculus agents, desanitizing agents, antimicrobial, anti-plaque, anti-gingivitis agents. So they mostly contain these 15 items, all or someone in a good toothpaste. Now, 2 ingredients are there. First, we'll learn one by one. What is abrasive? So abrasives, the main components responsible for the cleaning the teeth, should be abrasive enough to clean the tooth and avoid damage to tooth surface. Ability depends on particle size, shape, and brittleness of the material. So this type of abrasive material is required in a toothpaste. Example as what they use as abrasives are hydrated silica, calcium carbonate, calcium pyrophosphate, calcium phosphate dihydrate. Third one is toothpaste ingredients. Second is detergent. So major contributor to teeth cleaning process should be tasteless, non-toxic, non-irritant, producing large volume of non-gagging foam. Example, sodium lauryl sulfate, sodium lauryl sarcosinate. Humectants. What they do, they prevent toothpaste from drying out glycerin 50% of the solutions. Examples, sorbitol, hydrogenated starch, hydrolysate, propylene glycol. So what disadvantages have bitter taste. There's xylitol. Advantage one is sweet and coolness feeling. Second, it is anti-caries. Thickening agents. They need to maintain the stability of high solid dispersion, affect the dispersibility, foam, character, and mouthfeel. Example is sodium carboxymethyl cellulose interacts with cationic antimicrobials. Then the hydroxypropyl methyl cellulose, they have hydroxy, ethyl cellulose, xanthine gum, then carbamals. Flavor. Influence consumers' acceptance, leaves a fresh, clean feeling after brushing, considers highest cost ingredients in the toothpaste formulations. Examples, peppermints, spearmints, menthol, wintergreen, and cinnamon. Sweeteners. Most flavor oils have bitter tastes, leaving the toothpaste formulation unpalatable without sweeteners. Artificial sweeteners are used. Non-carcinogenic effects like natural sugar. Examples, saccharine, sodium saccharine, potassium as sulfame. Then there's xylitol, can't be metabolized by mouth of oral cavity, has great sweetening power, promotes remineralization of the dental enamel. Sorbitol, it is a humectant. It has high refractive index, so used in transparent toothpaste formulations. Then preservatives, rarely used nowadays due to safety concerns. Proper formulation and ingredient selection can result in preservative-free toothpaste. Eighth, corrosion inhibitors, used to avoid corrosion of the aluminum tubes. Sodium silicate, not needed nowadays due to the use of plastic tubes. Anti-caries actives, fluoride ions reduce the incidence of caries lesion by reducing the acid solubility of tooth enamel. Examples, sodium fluoride, sodium monofluorophosphate, stannous fluoride. So FDA recommends level of soluble fluoride is iron bin 850 to 1150 ppm. Now, anti-calculus agents, they are examples, zinc chloride, zinc citrate, tetrasodium pyrophosphate, disodium pyrophosphate used more than zinc salts and it has anti-plaque activity. Desensitizing agent, they are potassium nitrate, compatible with fluoride and has already taste exam Sensodyne toothpaste. Antibacterial, anti-plaque and anti-gingivitis. triclosan, triclosan, chlorhexidine, and zinc citrates. Strip toothpaste, you may have seen a strip toothpaste. How? Only for aesthetic purpose. Two methods for strip toothpaste are used. One, two different colors toothpaste in an unusual type of packaging. Second, filling the tube with strip paste. Then the double compartment tubes, more expensive, reserved for dual action toothpaste. Example, Colgate whitening. The collapsible tube has two tanks and filled with each color paste. Squeezing the tube pushes the toothpaste out of the opening. The strip paste filling, how they are filling. Less expensive examples, Aquafresh. Filling is done using a multi-nozzle filling head that dispenses a different colored strips striped in each direction.